You know that nagging stiffness, that feeling like your own body is putting up roadblocks when you just try to move? Well, if that sounds familiar, you're in the right place. We're about to break down a specific hands-on approach designed to tackle that exact feeling, manual therapy.
Right? We've all been there. Whether it's from sitting at a desk all day, maybe recovering from an old injury, or just, life. Our bodies can sometimes feel less like our own and more like a puzzle we just can't seem to solve.
It's that exact feeling, that sense of being restricted. You go to reach for something or bend down, and nope. Your body just puts on the brakes with stiffness or even a sharp mechanical kind of pain. It's so frustrating, and it can really start to limit what you feel you can actually do.
But what if I told you there's a targeted approach that doesn't just put a Band-Aid on the symptoms, it actually gets to the root of those mechanical restrictions? And that, my friends, is exactly where manual therapy comes into the picture.
So let's get right into it. What exactly is manual therapy? Because understanding what it is really the first step to seeing how it could help.
At its core, manual therapy is a really specialized part of physiotherapy. A therapist uses their hands to apply super precise techniques to your joints and the soft tissues around them. And the goal here isn't just temporary relief. It's all about fixing the underlying mechanical problem, like a joint that isn't gliding the way it should, or a muscle that's just stuck in a tight knot that's causing the pain and holding you back.
Okay, I know what you're probably thinking. Isn't that just a fancy massage? And that's a great question, probably the #1 question people have. And while they both involve hands-on work, their goals are totally different. And this really makes it clear, right? A massage is fantastic. We love them. They're great for general relaxation and loosening up tight muscles. But manual therapy? That's a whole different ballgame. It's clinical. It's diagnostic. It uses super specific techniques to improve how your joints move and how your body functions. It's not a one-off spa day. It's a key piece of a bigger rehabilitation plan.
All right, so the big question, how do you know if this is something that can actually work for you? Let's see if any of these ring a bell. We're talking about that joint stiffness that just won't go away, or muscle tightness that literally stops you from moving freely. Maybe it's that pain that only shows up when you move a certain way. Or, hey, maybe you've hit a wall at the gym and you feel like stiffness is what's holding you back. These are all classic signs that some kind of mechanical restriction might be the real culprit. Okay, so let's pull back the curtain for a second. If you actually went for manual therapy, what happens? I promise, it's not random. It's a really structured and thoughtful process. It all starts with a thorough assessment. The therapist is basically a detective trying to find the root cause. Then they'll use techniques like joint mobilization, which is just gently guiding the joint to move better, and specific soft tissue work to release all that tension. But here's the crucial part. It's then combined with exercises for you to do. And the whole time, they're reassessing and adjusting to make sure it's actually working. And I really need to stress this point. This should not be painful. A skilled therapist works with absolute precision and care, always staying within your comfort zone. The whole goal is to encourage movement and restore it, not to force it. Okay, this next point is arguably the most important one. The hands-on work is powerful, for sure, but it's not the last step. Real, lasting success comes from what happens next. Think about it like this. The therapy basically opens a window of opportunity. It gets things moving and dials down the pain so you can move correctly again. But to keep that window propped open, you have to be an active participant. The exercises and movement retraining that come after, that's what makes the changes stick around for good. So at the end of the day, manual therapy isn't about making you dependent on a therapist. It's the complete opposite. It's all about putting you back in the driver's seat, getting your body to function like it's supposed to, and giving you the tools you need to maintain it all by yourself. So I'll leave you with this question. Just imagine, for a second, your body without all those restrictions, without that constant stiffness. What would that freedom of movement let you do? What could it bring back into your life? That's the potential we're talking about here.